Hello, my name is Ingrid Hutchinson and I'm a dietitian in Ireland working for Resilience Healthcare. Tonight, I'm going to take us through a presentation looking at how nutrition structure and safety in PWS residential settings can work. Tonight, I will discuss how we provide structured, safe and person-centred nutritional care within our residential service, supporting 15 individuals with prader-willi syndrome in Ireland. Nutrition is one of the most important aspects of care in PWS because of the unique relationship individuals have with hunger, satiety, and food anxiety. Our approach is built around safety, dignity, consistency, and quality of life. I'll outline how we use food security principles, trauma-informed care, evidence-based nutritional practice, and individualised care planning to support the people living in our service. This presentation will briefly cover why nutrition structure is so important in PWS, how our service organises nutritional care, and the safety measures we use to protect well-being. I will also discuss how we individualise care plans, involve multidisciplinary professionals, and ensure our practice remains person-centred and evidence-based. People with PWS experience persistent hunger alongside lower calorie requirements, which creates significant health and emotional challenges around food. Because of this, nutrition in residential care must be highly structured and consistent. Predictable routines help reduce anxiety, distress, and food-related behaviours. The aim is not restriction, but creating a safe, supportive and therapeutic environment that promotes health, dignity and independence. Our nutrition service is built around 4 key principles. Firstly, food security helps reduce anxiety by ensuring meals, routines and food access are predictable and consistent. Secondly, we use person-centred approaches by supporting choice, preference and participation wherever possible. Thirdly, staff use trauma-informed practices, recognising that food-related situations can create emotional distress. So support is delivered calmly and respectfully. Finally, all nutrition care is evidence-based and guided by dietetic inputs to ensure the meals are safe, balanced and appropriate for the individuals with PWS. Structure and consistency are essential in nutritional care for people with PWS. Meals and snacks are planned and delivered at consistent times each day, with clear routines followed across all staff teams. Structured food access helps reduce uncertainty and anxiety. The environment is also important. Safe food storage, calm meal times, and appropriate communication supports all contribute to a positive and safe experience. Overall, this structured approach supports emotional regulation, physical health, safety, and independence. Food security is a key principle in supporting people with PWS, as we all know. When individuals know when meals and snacks will happen, what to expect, and that routines are consistent, anxiety around food can reduce significantly. In practice, this means planned meals, structured food access, and consistent responses from staff teams. A predictable environment helps reduce stress, supports emotional well-being, and promotes safer outcomes for the individuals we support. Although structure is important, care must be highly individualised. Each person has different health needs, preferences, communication styles, and support requirements. Individual care plans are developed using comprehensive assessments and multidisciplinary input. Plans include calorie requirements, meal support, preferences, and identified risks. Menus are tailored to the individual while maintaining nutritional balance and consistency. Where possible, individuals are involved in planning and decision-making to support autonomy and dignity. Even within structured nutritional systems, individuals should experience choice, inclusion, and meaningful participation. Trauma-informed practice is equally important. Conversations around food can become emotionally charged very quickly. Therefore, staff must use calm, respectful, supportive approaches rather than confrontation or punishment. This can sometimes mean that some individuals may not wish to meet with a dietitian as they may find it quite a stressful experience, and therefore will communicate what changes or choices they would like in their menu plans via their key worker or the manager within the house they live in. The overall aim is to preserve dignity, build trust, and to reduce emotional distress while maintaining safety. Safety is a major component of nutrition support in Prader-Willi syndrome. Without structure and supervision, there can be serious risks, including rapid weight gain, unsafe eating, and significant health complications. Our service uses individual risk assessments, environmental controls, and consistent staffing approaches to support safety. Staff receive training in PWS-specific care, and incidents are reviewed carefully to support learning and continuous improvement. Monitoring is ongoing, and multidisciplinary reviews help to ensure care remains effective and responsive. Nutritional care in PWS requires strong multidisciplinary collaboration. Dietitians provide specialist nutritional guidance. Speech and language therapists may support swallowing safety. Behavioural support professionals assist with emotional regulation strategies, and frontline staff ensure nutritional care plans are implemented consistently every day. Families and advocates are also important partners in care. Good communication across the MDT helps maintain consistency and improves outcomes for the individuals we support. Good governance is essential to maintaining safety and high-quality nutritional care. Our service uses policies, audits, staff training, and regular reviews to ensure standards are maintained. Practice is aligned with HICWA, which is an independent government-funded statutory body in Ireland that acts as a regulator for health and social care services. So our practice aligns with their expectations around safeguarding, person-centred care, and quality assurance. We also focus on continuous improvements by reviewing outcomes, listening to feedback, and adapting supports when needs change. When nutrition support is consistent, individualized and compassionate, it can have a very positive impact on the people's lives we support. Outcomes are not only physical, we also see benefits in emotional well-being, reduced anxiety, and greater participation in daily life. Ultimately, our goal is to create an environment where people feel respected, safe, and supported while achieving the best possible health outcomes. To summarise, nutritional care in PWS is highly specialised and relies on consistency, structure, and collaboration. Food security principles help reduce anxiety and support emotional well-being. Care must remain person-centred and trauma-informed while maintaining clear safety boundaries. Through individualised planning and multidisciplinary support, we can both support the health and quality of life of the individuals we support. I'll now open up if anyone has any questions or any comments. Thank you.